Thank you very much for taking the time to talk to us. So if you could just give us all an introduction as to who you are and why you're at this half-day symposium for our 10-year anniversary.
Well, my name is Professor Luke Clancy.
Yeah.
I'm the Director General of the TobaccoFree Research Institute of Ireland, and also a clinician, a respiratory physician. Here as one of the co-sponsors of this event, the Research Institute, which was established to provide the evidence base for the government for their tobacco control interventions. So obviously we're delighted to be here today, and we're delighted that this is such a success.
Yeah.
Both the day, but particularly the last 10 years, which have seen Ireland transformed. And I think it's fair to say that the culture of smoking in Ireland has changed forever.
Yeah.
And has been a huge influence globally as well.
Absolutely.
Certainly much of Europe has now followed the Irish example in tobacco with regard to smoke-free, and also other countries all over the world. So it worked, and it's been copied. Obviously from the populist point of view, it's okay, it worked, but did it do any good? So my job was to see what effect the ban had.
Yeah.
And no matter how we looked at it, it seemed to be a success. Particularly in health matters, it relieved chest symptoms, so that people had less cough, less phlegm, less irritation, less asthma. Children had less. So that was grand, but we also have been following for the last 10 years and showed that mortality, deaths from ischemic heart disease, from stroke, from cancer and from COPD have reduced, and to the tune of about 1,200 people per year.
Phenomenal.
Who did not die because of the smoking ban.
And that's something you should be really proud of, that your research has shed light on just the impact this has had on our society.
Well, I think that that's important. I think if you do this kind of thing and you cannot stand it up and say, yes, we did it, people obeyed it, but it also changed lives. It got people to live longer, to live healthier lives, and also our children not to be afflicted with this. We have, the prime aim of the legislation was to protect workers in the service industries in particular from exposure to secondhand smoke. And that was what it tried to do, and also of course non-smokers who were exposed. It was hugely successful in that, but to see the health effects in the general population was beyond our wildest dreams, so we are delighted with that.
I can imagine, and you've every right to be as well. And can I ask you, what role do you think research has in pushing forward this ideal goal of being a tobacco-free Ireland in the year 2025?
Well, as you know, the Minister has said Ireland will be tobacco-free according to that definition of 5% by 2025. Now, I'd have to tell him that our research using simulation modelling says that unless we do something new, it's not going to happen. So the importance of research in this context is to try and innovate, to see where is it we can go. We know from the Framework Convention on Tobacco Control that certain things work. We're doing most of them, we're doing them better than most people, yet we have a high prevalence of smoking. It's clear to me that we have to come up with new and innovative ways of changing people's culture and of protecting people from smoke, but also of helping people to stop smoking. The statistics show that even if no child took up smoking, we wouldn't be rid of cancer due to smoking for 40 years.
It's a long time.
So what's important now is that we get the people who do smoke to stop. So research on smoking cessation is very important. In our analysis and modelling, we showed the other way that Ireland, because Ireland is, as I've suggested, a leader in tobacco control, but one of our weaknesses is in use of the mass media. Persistent media, explicit media, showing the harmful effects of smoking on a consistent manner, using witnesses, getting experts. This has to be sustained. We often tend to bring in a campaign for a few weeks and it looks great, and then it's gone. What we know about media is that it has to be sustained. And I think one of the roles of the researcher is to independently assess how that's going, so that we don't clap ourselves on the back because Granny saw it in Listowel and she thought it was wonderful. We really have to get the hard data to show what is effective and what's not. And these are kind of the roles that I think are important in tobacco control. But also, we have to be careful and watch what the industry are doing. These people are well resourced, they are unscrupulous, so we have to monitor them. And we have to combat their arguments. For instance, they will say things like, oh, high prices cause smuggling. That's so easy for people to believe, but it happens to be untrue. So the function of the researcher is to show what the truth is and to make that available and to use that as a tool to change the perspective about tobacco control in this country.
And it's a very powerful tool too. It's a tool that will cause change as well. It will bring about change.
Absolutely. I think without the evidence base, nothing will change.
Okay.
So research is key.
Well, you certainly got that message across very, very well for our viewers. And thank you very much for taking the time.
Thank you.